This is Richie Suarez, or I should say Dr. Richard Suarez. He's a real-life hero. Richie is a pediatric oncologist caring for kids with cancer. But Richie almost didn't have that chance himself. Richie suffered from cancer himself as a child. He survived, but ended up with so much debt that he almost couldn't achieve his dreams by going to college and becoming an oncologist. So what ended up happening is there's a charity called Cancer for College that stepped in and provided a scholarship for Richie to allow him to become a superhero. And so I started to get involved with this charity, Cancer for College, and realized, what a great charity. What was the root cause? Was it really this debt or paying for care? And ultimately, I sort of came to the conclusion that the real issue ultimately was medical debt. We care for people, we get them better, we give them an opportunity to thrive in their life, but they're in such financial ruin from medical debt that they can't achieve their dreams. And so in 2020, there's $140 billion of medical debt in this country and growing. It impacts minorities more than others, which is a significant issue today and in terms of just fairness and equality. So what's causing this? This is the easy slide, right? I mean, Cigna, CVS, and United made $30 billion last year. Their main function is to provide effective health care to Richie and people like that. And this continues to happen and go up every year. So you would think, what's causing this debt? You'd immediately say it's the uninsured, right? But 75% of the households with medical debt actually had insurance. So is it really working? So the biggest issue that I see or that we see is that the patient is no longer in the center of the equation, right? Hospitals and physicians exist to take care of patients. Health plans exist to pay for it. But somehow the patients are taking on the burden of the broken system. Even the term medical debt, and I owe this to Jeff Matus over here, he gave me this, this thought, is it has a connotation that someone did something wrong, right? If you have debt, you must have done something wrong, bought too many shoes or something like that. So we really need to also change the lexicon in healthcare, right? I mean, we're using language that sort of pushes the responsibility away from who is really causing the issue, right? Most cases, you just get care and you end up with debt for no fault of your own. So what do we need to do? The way I look at it after 25 years of doing this is we need easy to understand cash pricing that's transparent. What do these things cost? So when we have to pay for it, we can, right? We need health plans that are actually there for us when we're most vulnerable, right? When we get that bill and we owe the money, whether it's a high deductible health plan or anything else, you got to answer the phone. Tell me if it's what I should pay. Make sure it's fair. And that's not happening today. So we also need health plans and hospitals to take accountability for their role in this process. I mean, hospitals are overcharging and making it too complicated and have aggressive tactics for collecting, most of them. And health plans have inefficient networks with poor rates that are hard to understand. So what can you do as an employer? We're spending large amounts of money to try to take care of your employees and make sure they stay with you and they're happy and they're healthy. We have to really hold the health insurance company and our consultants accountable for not just the rate or the benefit, but really the effectiveness of the care and the well-being of your employees. Unfortunately, as an employer, you don't really know this, right? You don't know how well they're doing. So it seems a little hopeless, right? So what can you do in this system that's not really working? There are programs that you can give your employees to help them navigate the system and negotiate medical debt. You can help organizations like Cancer for College. There's a company called RIP Medical. But really, whether it's for Richie Suarez or our families or our kids, we have an obligation to fix this system for ourselves, our employees, and our families and communities now. We can do it, and we have to. It's that critical in my view. We talk about a lot of things in this country that are concerning us, but you think 50 years out to this healthcare system and think about your children or your grandchildren accessing care and think about what that looks like. We have to get this done now. So thank you.